We're here at the International Conference in Vienna, 2010, with Jose Zuniga, who is the president of the International Association of Physicians in AIDS Care. And we are following a press conference that you presented some data, and it was on the somewhat the social aspects.
Well, this is the AIDS Treatment for Life International Survey, or ATLAS. It's the second time we've conducted the survey. The first was for the Mexico City conference. Mm-hmm. And we surveyed 2,035 patients in 12 countries, most of whom, or the majority of whom, were on antiretroviral therapy, to assess their perceptions about HIV disease and its treatment, as well as social issues such as stigma and discrimination.
Mm-hmm. And the big question is, I think that there was some concern that the people who were engaged in the survey did not maybe understand the aspect of resistance. Mm-hmm. And I'm wondering, how can we solve that? Do we have to do an educational seminar before the survey takes place, or can that be done in a statement, or how would we correct that kind of situation?
Well, we identified a number of gaps, and they specifically were in the realm of physician or healthcare provider patient communication. The conversations are happening on a certain level, but are not as robust as possible. So we found gaps in communication as far as the importance of adherence, the repercussions of resistance, issues related to smoking, a failure of healthcare providers to have a conversation about the implications of smoking if you're HIV positive. In fact, these are quite severe, and we had data at CROI earlier this year indicating that people living with HIV/AIDS who smoke are at higher propensity for both lung cancer and heart attack and stroke. And so there's a great deal more education that needs to happen in that realm, and I think we do need to train or empower people living with HIV/AIDS to both discuss matters that are really important to have a conversation about with their physicians, but also to ask questions and to demand the time of their healthcare provider to do a good job and have treatment outcomes that are successful.
Well, that's something that we're really talking to them. This is the audience that's saying, am I doing all that I can for myself? Self-advocacy is extremely important today. And again, I agree with you, we should have our patients informed that they should demand, I hate to use the word demand, but in a sense it is, demanding the time you need to really sufficiently cover the territory with your physician. So what are some of the other projects, or how will you move this project forward in the future? You will you not?
We will move it forward. I'm hopeful that we'll have ATLAS 2012, and that in that time frame we will have addressed some of these gaps in a significant way. We've issued a call to action that includes some coalition meetings between professional medical and nursing schools and nursing associations and community-based organizations and AIDS service organizations, just to see how we can ramp up education, and as important, provide some guidance to nurses and physicians about how best to speak to their patients and how to involve their patients as true equal partners in decision making.
Great. This is really good to hear. I am also wondering, is it possible, if you do make changes to the survey, that you can still use it in its barest form to draw comparisons from previous respondents?
Mm-hmm. Absolutely.
So you'll be able to show comparison.
I think we're going to try that. The other thing we'd love to do is not just survey people living with HIV/AIDS, but also their healthcare providers.
Right.
Because we want to get the other side of the story.
Exactly.
We're being told by patients what is actually what they believe is occurring within the clinic. Mm-hmm. We want to hear from doctors. What is the obstacle to you asking a patient about his or her smoking history? What is the obstacle to you providing tools for your patients to adhere to therapy?
Right.
And in that way, we think we can get an even better snapshot of what's occurring out in the field.
It seems like the doctors seem to know the patients better than they know themselves.
Mm-hmm.
I don't want to, again, I don't want to disparage anyone. I'm a patient too, but I feel that may be the case, because doctors are there looking at lots of patients, and sometimes patients tell the doctors what they really would like to do, but whether it's what they're really going to do is another thing.
I think you've identified a significant gap, and I think in this era where patients are self-aware and educating themselves about their treatment options, they need the next they need to go the next step and learn how to communicate with their providers.
Right.
And sometimes it's okay to question the decisions that a provider is making, or to say, hey, I heard about this smoking study and I'm still smoking, what can I do? And the providers need to be honest and say, well, you have a therapeutic option, you have a lifestyle option you could pursue here, and not say, for example, well, HIV is a stressful condition, so you smoke, I'm going to let that ride. Because in essence, what we're finding is that smoking can have just a horrible effect on someone's life, and you die of a heart attack, but you're doing just fabulous on your HIV treatment.
Yeah, right. So is there anything else you feel that we need to cover here? Because I'm very pleased that you've come and said the words that you have, because they really feel they're ringing the importance that I wanted to hear from you.
Thank you so much. Well, I would only add that in addition to being a good patient, we need to focus on good doctors too.
Yeah.
Doctors have a responsibility, and nurses have a responsibility to listen to patients and spend the time that's required.
Yeah.
And if a doctor or physician or nurse doesn't want to do that, there are many more out there.
Right. And that doctor has to right, exactly. The doctor has to make that patient feel comfortable in giving them the honest answer.
That's right.
Yeah,
so if you feel that a healthcare provider is judgmental, if you feel that after you have a conversation with the healthcare provider, they still will not spend the time,
then
move on.
You're not working in a way that it can be productive.
Right.
Yeah.
It has to be a team effort.
Exactly. Well, thank you so much. I appreciate the time with you.
Thank you.